Hello and welcome. Today's session is about smart diagnosis. It will be taught in two parts. Part 1 will be using smart diagnosis. Part 2 will be teaching you how to set it up. If you notice, I'm on a patient's account inside a template called ENT Specialist. At the bottom of my template is a section called Diagnosis and Treatment, also commonly known as Assessment and Plan or Impression and Plan. The physicians need to diagnose a patient and determine what treatments they may be doing on a patient. These are set up as liquid links. So I've created a liquid link for diagnosis and for treatment. Treatment, also commonly known as CPT or procedure, and those liquid links will then allow, once I do smart diagnosis, to throw in my diagnosis and treatment into my chart note, which helps my physician's template. At the top of my screen in my toolbar, I have a smart diagnosis icon. What you'll notice from the smart diagnosis icon is that I'll be able to go in there and actually help my physician quickly pick the most common things that they do for a diagnosis they commonly treat for. If you don't have a smart diagnosis icon on your toolbar, go out to the right hand side where there's a plain area, right click and hit Customize. This will give you the Customize toolbar option. You should be able to find your smart diagnosis on the left side of your screen. Once you highlight it, you can hit your right arrow Add button and it will put it into your toolbar. At that point, you could move it left or right on your toolbar or up and down so that you actually can locate it on your toolbar wherever you would like to see it. My Smart Diagnosis is already on my toolbar. So I'm going to go ahead and click on Smart Diagnosis, and then what you'll see is that I can pick a diagnosis, and what happens when my physician said this is a diagnosis the patient has otitis media. Because of the ear infection they have, I need to do one or more of these procedures. I need to prescribe one or more of these drugs, or print off some patient education sheets, as well as insert tags or macros into my note to help me template that much faster. So I'm going to say for this patient, I'm going to do a removal of the impacted earwax and I'm going to do a Timpan on the patient. I then want to prescribe that patient amoxicillin and children's Tylenol, and I would like them to get education sheets on ear infections and talk about possibly giving the patient ear tubes someday. As well as in the tags, I'm going to go ahead and say I want the paragraph I commonly use for ear infections to insert, as well as a diagram for ear tubes. Those will automatically populate inside my note. So I've created in the setup my favorites, and now as a physician I just check off what exactly I do for this patient with otitis media. Once I hit Save and Close, it'll automatically launch me into my education sheets. So right there, it just printed both of my education sheets, or populated them to be printed. I can then hit the print button, and then it'll print wherever I associate my printers to. I can hit Save and Close, and it takes me into the prescription writer. At this point, it's writing a prescription for amoxicillin and children's Tylenol, since those were the two that I picked. I hit Save and Close, and it documented inside my template or my chart note the diagnosis that I picked, as well as the two procedures that I'm doing in my office. At the same time, realize that that can go over to our billing PM system, so our billing is accurate as well. Beyond that are the two tags. So this was the first tag as this paragraph, and of course I can customize this information to look however I would like to and can add to it, but that's an automatic insert of a common tag I use, as well as this diagram was set up as a tag because I'm thinking about doing tube insertion on this patient. So it's that quick to get all of my smart diagnosis to help me write my prescription, my education plans. It helped me design and document my diagnosis and treatment, as well as put in my most common tags that I use. So that's it. That's how you use smart diagnosis. Part 2 is going to be showing you how to set it up. To set up smart diagnosis, you need to go to the Edit button, or the Edit ribbon option. Edit is where you create all of your masters. When you click on Smart Diagnosis, what you're going to see is a launch of all the diagnosis codes on the left-hand side. So you can pick the diagnosis code that you may want to build and of course, the biggest thing is to get this information gathered before you come out here to build them. But once you pick your diagnosis, it inserts it into the middle section here where you can actually watch it being built. Now at this point, on the left or on the right side of your screen is the CPT codes, the tags, drugs, and patient education options that help you build your smart diagnosis. So I can say, what procedure codes would my physician possibly do when he sees a patient for the otitis media? So I can pick the diagnosis code, double click it, and it inserts it into my build option as I'm starting to build the reasons why a patient might come in. I can also grab several of them just by getting close and saying, okay, I need to do a 92560, 92561, 62, 63, 64, 65. We'll go with 67 and 68 and 69. So these may all be options that our practice may use when they're diagnosing a patient with otitis media. I can then go down to my tags and say, actually, for this particular problem, I want the ability to insert multiple tags. You'll notice that I have multiple ear tags, so I can click on one of each. There's multiples out there because you have them by provider and by practice, but I really only need one of each type. Once I get my tags built, then I can come out here and say, okay, what kind of drugs would I possibly be giving to a patient that has this problem? So usually children have a lot of otitis media problems, so I would definitely want some chewable amoxicillin, and I can say I want chewable amoxil, and then maybe for pain, Tylenol, as I had showed you in the other example. So I guess I need to spell Tylenol correctly. Once I pick which Tylenol I'm doing, so I will go with a children's Tylenol and have that as an option out here as well. I can then go down to my patient education section and say my patient education is ear related as well. So I can pick my ear and say I need an ear infection for otitis media, and an ear tubes are my education sheets that I might use, or maybe even ear drops. So I can build as many items as I want in each section just by finding them, which some of them are templates or tags. Patient education is also templates, don't forget about that. And then of course going into my drugs area and assigning what kind of prescriptions that I commonly write for a common problem. Once I'm done with this, I hit save and close, and I have just created a new smart diagnosis. I will show you under Edit Smart Diagnosis once again that there's a couple radio buttons in here. There's an associated radio button, unassociated, and all. If I click on associated, you'll notice that there's a green icon out here that's telling me that all of these are really smart diagnoses. If I go to unassociated, you'll notice all my diagnoses with the blue arrow and not a green associated ICD-9. I can of course look at all of them, and as I'm scrolling through you'll notice the green options out there for diagnosis codes that have them associated, like this one. So it's just another way to view your associated diagnoses. So that's it. I hope you learned a lot and are able to use Smart Diagnosis.